Welcome again. In this session, we will see the drug absorption patient related factors. Learning objectives. Student will able to explain patient related factors affecting to drug absorption. Before discussing the factors, we will see the gastrointestinal tract. So the main function of gastrointestinal tract is the digestion and the absorption. It is having approximate length of 450 centimeter and divided into the major parts, that is the stomach, small intestine and the large intestine. Let us move towards the stomach. It is having the bag-like structure. The surface area of the stomach, it is very small, approximately 0.2 meters square. It favors the absorption of acidic drug as the acidic drugs are unionized in the stomach pH. Stomach pH favors the dissolution of basic drugs due to salt formation. Food or the dosage form, it is going to reside for approximately 1 to 2 hours into the stomach. So this is about the stomach. Small intestine, comparatively it is having the large surface area, that is 200 square meter. The length of small intestine is about 300 to 500 centimeter. Blood flow to the small intestine, it is 1 liter per minute. The pH of small intestine, it is about 5 to 7.5. Comparatively, there are the slow peristaltic movements than the stomach. The residence time of the small intestine, it is about 3 to 6 hours, and most of the drugs gets easily permeated through the small intestine. So this is about the small intestine. Large intestine is having a very small surface area, that is 0.15 square meter. Length is about 110 centimeter. Blood flow to the large intestine, it is 0.02 liter per minute. pH range, it is 6 to 8. Residence time 6 to 12 hours, and it is important for the absorption of poorly soluble drugs and the sustained release dosage form. In all the types of the drugs gets well absorbed into the small intestine than the stomach and the large intestine. Moving towards the patient related factor, very first factor, that is the age. In the case of infants, the gastric pH is very high than the less intestinal surface area, and blood flow to GIT is also less. In the case of elderly, there is an alteration in the gastric emptying which alters the dissolution as well as the absorption of drug. Then intestinal surface area gets reduced due to the destruction of villi and microvilli. Blood flow to GIT gets decreased due to the organ compromission, and there is a higher incidence of achlorhydria and the bacterial overgrowth that may lead to the alteration in the dissolution as well as the absorption of the drugs. So this is about the age, that is the infants and the elderly. Moving towards the gastric emptying. Gastric emptying, it is nothing but a passage of drug from stomach to the small intestine. It is one of the rate limiting steps for the absorption of a drug. Rapid gastric emptying increases the drug absorption. In certain cases, the rapid gastric emptying is advisable. For example, Rapid onset of action is desired or required. Dissolution occurs in the intestine. Drug is unstable in the stomach. Drug gets best absorbed from the intestine. Gastric emptying can be promoted by taking the drug on empty stomach. Delay in gastric emptying is advisable in the case food promotes the dissolution as well as the absorption. For example, griseofulvin. Disintegration and dissolution promoted by the gastric fluid. For example, griseofulvin. Drug dissolves slowly. Drug irritates the gastric mucosa. For example, aspirin. Drug absorbed in the proximal part of intestine. For example, vitamin B12. Moving towards the definitions of gastric emptying rate, gastric emptying time, gastric emptying half-life. Gastric emptying rate, the speed at which the contents gets emptied into the small intestine, that is known as the gastric emptying rate. Gastric emptying time, it is nothing but a time required to empty the content from stomach to the intestine, that is known as the gastric emptying time. While gastric emptying half-life is nothing but a time required to empty the half of the content from the original, that is known as the gastric emptying half-life. Barium sulfate is used to determine the gastric emptying. Certain factors which are going to affect the gastric emptying. That is, the factors are volume of meal, composition of meal, physical state, viscosity of meal, temperature of meal, gastrointestinal pH, electrolyte and osmotic pressure, body posture, emotional state, exercise, disease states and drug. So, alteration in gastric emptying affects the dissolution as well as the absorption of a drug from the gastrointestinal tract. Let us see the intestinal transit. In intestine, the peristaltic movements are slow and which promotes the intimate contact of formulation or drug with the membrane, and thereby there is a increase in the absorption of a drug. There are certain cases in which delay in intestinal transit is desirable or required. For example, sustained release product. Drug dissolves in the intestine, then drugs which have the absorption window, and the drug shows the slow absorption. So these are the cases in which the delay in intestinal transit is desirable. Let us move towards the gastrointestinal pH. Already we have seen the pH partition hypothesis and which clears how the dissociation constant and pH of gastrointestinal fluid affects the drug dissolution as well as the absorption. In the case of very first point, that is the disintegration. For example, entry coated tablet. There is in certain cases like the achlorhydria, in which the entry coated formulation gets disintegrated into the stomach. Second point, that is the dissolution. Acidic drugs well dissolved into the small intestine and basic drug gets dissolved into the stomach. Third case, that is absorption. Acidic drugs gets well absorbed from the stomach and the basic drugs well absorbed from the intestine. With last point, that is stability. There are certain drugs which are unstable in the acidic environment. For example, erythromycin, histioid or the penicillins. So this is the effect of gastrointestinal pH on the dissolution and the absorption. As we know that the stomach contents are acidic in nature and the small intestine contents are basic in nature. Disease state. There are three disease cases we are going to discuss, that is gastrointestinal diseases, cardiovascular diseases and hepatic diseases. Gastrointestinal diseases, For example, achlorhydria. Achlorhydria, it is nothing but a absence of acid in the stomach, which alters the dissolution as well as the absorption of certain drug. In the case of celiac disease and Crohn's disease, as well as in the malabsorption, there is a destruction of the villi, microvilli, and thereby reduces the absorption of the drug. In the case of gastrointestinal infections, for example, diarrhea, the absorption of drug is going to be altered. In certain colonic diseases and gastrointestinal surgery also alters the absorption of drug. So this is about the gastrointestinal diseases. In the case of cardiovascular diseases like the congestive cardiac failure, the cardiac output gets decreased and which reduces the blood flow to GIT and thereby the absorption of a drug. In the case of hepatic diseases like the cirrhosis, first pass metabolism gets reduced and increases the bioavailability of the drug. So this is about the disease state. Blood flow to GIT. Approximately 28% of cardiac output reaches to the gastrointestinal tract and which helps to maintain the sink condition. The presence of food which alters the blood flow to the GIT and thereby affects the absorption of drug. So this is about the blood flow to. Moving towards the gastrointestinal content. Very first point, that is a food-drug interaction. The presence of food in the GIT delays the absorption of drugs like aspirin, paracetamol, diclofenac and digoxin, while the presence of food decreases the absorption of penicillins, erythromycin, tetracyclines and iron. The presence of food increases the rate of dissolution of certain drugs like griseofulvin, diazepam, vitamins and thereby increases the absorption of drug. Fluid volume. Large fluid volume results the better absorption, better dissolution and rapid gastric emptying. Moving towards the normal gastrointestinal constituent, for example mucin. There are certain drugs which forms the insoluble complex with mucin and thereby decreases the absorption of drug. Presence of bile salt which increases the absorption of lipid soluble drug. There is the bile secretions. Moving towards the drug-drug interactions, which are divided into physiochemical drug interaction, physiological drug interaction and altered gastrointestinal metabolism. Antibiotics, which alters the gastrointestinal metabolism of the certain drug and viability or the absorption of these drugs gets increased. In the case of physicochemical drug interaction, for example adsorption, there are certain drugs are there which gets adsorbed on the surface and the absorption of drug it is going to be reduced. There are certain drugs which forms the complex with the drug and its absorption gets altered. For example tetracycline with milk. Change in a pH, change in a gastrointestinal pH which alters the absorption of drug. In the case of physiological drug interaction, for example propantheline decreases the gastrointestinal transit and thereby alters the absorption, while metoclopramide increases the gastric emptying and alters the absorption of certain drugs. So this is about the drug-drug interaction. Moving towards the first pass effect. So first pass effect, it is nothing but the loss of drug through biotransformation by GIT and liver during its passage to systemic circulation. So there are certain enzymes are there which are responsible for metabolism of drug. First of all, we will see the luminal enzymes. For example, digestive enzymes. These enzymes present in the gut fluid which includes the intestinal and pancreatic secretions. Hydrolysis, that is the which hydrolyzes the ester. For example, chloramphenicol palmitate gets converted into the chloramphenicol, that is the active form of the chloramphenicol. Also, this hydrolysis which inactivates the proteins. Then the bacterial enzymes, which are produced by the bacteria and which catalyzes the certain reactions which are responsible for metabolism of the drug. Then gut wall enzymes, for example, alcohol dehydrogenase. Then the phase 1 and phase 2 enzymes, these are also responsible for metabolism of certain drugs. Then the hepatic enzymes, which are responsible for the metabolism of drugs. So this is about the bacterial enzymes, gut wall enzymes, and the hepatic enzymes and luminal enzymes. Thank you very much.